It's Therapy Tuesday right here on The Big Show. We have Dr. Geraldine Tan from the therapy room. Good morning, Jerry.
Good morning, Singapore!
loving the sunshine.
That's the way to start a day.
I know, right?
How are you doing, Jerry?
Bright and sunny. I'm doing great. Yes, and I was saying I was inspired by your plant-based diet, and I decided to try over the weekend.
And what are your thoughts?
It is interesting, very satisfying. I think Element is a little bit more Chinese, so they have Chinese cuisines there. So I was a bit afraid, so I went for the 5 course.
You were a bit afraid of what?
I was a bit of being hungry.
I love the perception. Huh? She's like, they're going to give me 1 grain of rice, 1 leaf of vegetable, and soup.
Oh, that's awesome.
I don't know. People were always saying, in the past about vegetarian food and everything, and they had all these misconceptions, right? So I walked in there and go, okay, I don't know whether I can do this or not. So 5 course it was.
And were you overly full after that?
Oh no, I was pleasantly surprised. It was nice. It was very satisfying.
When you walk away, you feel very clean, I find.
Yes,
clean.
Exactly. Very clean. I feel happier. Like, I've done something good.
Yeah.
Yeah, that's because you're not eating any animals and their dead spirits are not in you.
Okay, so Shaun tells us that today we're going to be talking about something very, relatable?
Relevant, he said.
Very relevant or very relatable?
And topical.
Same, topical, yeah.
Okay,
Something in the
so,
papers, right?
so what I did was I told Shaun, which means that Jerry, you have been irrelevant all this time.
No, just
Don't be mean, Glenn.
Never.
So, okay.
to share a story, yeah.
Jerry is always relevant, okay?
Yes.
Always relevant.
Okay, so you were saying
Is
it's something in the
okay.
papers recently? What was it?
Not recently. I think I was, it's all the cases that are coming up, and I thought I wanted to talk about it. And we read them in the papers. So just now when I talked about, even vegetarian food or plant-based diet, I had the delusion that, I would be hungry. So we are talking about delusions, illusions, and hallucinations.
Oh, you're talking about me.
You are
Which
a
one?
mirage.
Which one are you? Are you an illusion?
The whole lot of them.
Yeah. But I think I give myself pain today because as I was doing it, I was like, oh my God, my lecturer, my mentor was always trying to tell us the difference between all of it. And I'm like, oh my gosh, what is the difference? So I think I'm going to challenge myself today. So conquering fear today.
Okay.
But we see that in the movies also, like The Sixth Sense. If you know The Sixth Sense, I see dead people, and do we believe him or not? A beautiful mind, what is real and what is not real. So recently, I think I had a couple of cases, but one really stuck out to me because he came into my clinic catatonic. Catatonic means just rigid. And his brother, so he's a big guy, yeah? And probably Shaun probably Shaun's like stature. And his brother was carrying him and he was just straight.
Wow.
He was just straight. Yeah. Yeah, and then when we sat him down, it was very difficult because we had to tell him sit and push him. So he came in catatonic. So it was very interesting because when you look at him, he's a picture of just calm, right? There's no expression on his face. But when he came back afterwards, he said he heard all our voices and he was imagining the scenes that were going on. Imagining because his eyes were closed. Yeah.
So he was conscious of what was going on around him, but couldn't react? Is that what it was?
He doesn't know whether he is which is real and which is not. He is awake. So he should be conscious, but he could not distinguish between what was a delusion and what was hallucination and what was reality.
Wow.
Wow.
It was amazing. Yeah. So because I was so floored by that case, I thought, you know what? Let's go all out there today and talk about it.
Right.
Okay.
Okay.
And I saw the red card like Shaun.
We're talking to Dr. Geraldine Tan from the therapy room right here on 1FM 91.3's Big Show. We are also live on the Big Show TV. Meantime,
Okay, so Dr. Jerry, delusions, illusions, and hallucinations. What is
Yes.
real and what is not for people that are
Yes.
going through things like this?
So let's go with illusions. Let's clear that out of the way. So illusions is when something is real, but your eye perceives it as something else. Okay? So something like what Shaun does on the Big Show TV.
right.
He tricks all of you. So
Like Shaun, you're talking about Shaun Chua.
Yeah.
Yes.
Okay.
So he does all his little tricks, right? The Trick Eye Museum, when you go in, all those are illusions. So it is there, it is real, but your mind perceives something else.
Okay.
Da-da-da-da-da.
Yeah.
Just an illusion.
She's like, I don't know that song.
Now, you don't know that song? Okay, well, one of these days we'll play that song
Let's play that song
for you.
Okay, so that's
Okay,
an
we just
illusion.
Get him to sing. Yes. So those are illusions, okay? When we misinterpret something.
Okay.
Okay. Now, delusions are strong beliefs that you have that are not true.
Okay.
So it's in your head and you conjure up these thoughts. So an easiest way to talk about it is morbid jealousy. So if you've heard of morbid jealousy, so people, spouses that believes that the spouse is having an affair, and they're so strong in their belief, they start to see signs that are not there. Yeah. So then you have the spouses, and I had one before, sniffing the shirts,
Oh,
the
wow.
underwear, checking the
What?
underwear. Yeah, because she was so convinced, that her husband was doing something. It could be the other way around also. So the husbands that believe that are a little bit more techie, they put a tracker on the wife's phone, so they spy on them. So really, they spy on them.
So that's not really, but wow.
You should
okay,
check
okay.
out this movie by Sofia Coppola. It's on Apple TV
Yeah.
right now. It's called On the Rocks. It's something like what you were just talking about. It stars Bill Murray, Rashida Jones, and Marlon Wayans.
I'm writing that down. Sounds
Very
great.
good,
Oh,
yeah.
really? Is it a thriller then?
No, it's not.
Oh.
It's exactly what Jerry just mentioned. It's just a wife
Obsession,
who's
delusional.
who thinks that the husband is having an affair.
Yeah.
Right. Okay. So you've got the illusions, which and then you explained, and delusions you explained. So now the hallucinations.
The hallucinations are sensations that are not real. Okay, so sometimes they would say, "Oh, I've got like ants crawling on my skin."
But this is usually drug induced, right?
It can be. It can be. Have you had a sensation before?
Of
Is that
course,
why you-
absolutely. Just last night, after half a bottle of gin.
You were hallucinating?
Yeah.
You thought you were alone, but you
I thought I was in the studio already.
But still at home. FD also will hallucinate that the road is saying it, then he'll walk where the wind is blowing very strong.
That's true. That's true.
Gosh, thank goodness the drinking places are closed at 10:30
Right?
nowadays.
Yeah, man. Yeah.
Well, people just start earlier. That's all it is.
Yes, but they get home earlier also,
true.
so
That is true.
it makes it a
helps.
little bit safer. Yes, yes. Yeah. So it can be any one of our senses, our five senses. Yeah. And I think the most common that we hear from the schiz patients would be they hear things, people telling them things.
So that's considered a hallucination? I always thought hallucinations were visual. But you're saying sensation as well.
Yes, so there's auditory hallucination when you hear the words telling us, like voices telling you things, and it is really scary because sometimes the voices say, "Look, there's a window. Go and jump.
no.
Go and jump."
What?
Yeah. Yes. We've heard that before. Yeah, and of course, there's the one that Angel is talking about where they look and they see some things.
Jerry, how do we tell the difference between that audio hallucination and a multiple personality disorder?
Schizophrenia.
So schizophrenia and multiple personality disorder, right? That's a personality disorder. You switch from one personality to another personality, and it's quite apparent. So I had one with a multi-personality, and what I do know is three personalities. So one very quiet one that she has, one very aggressive one, and one is just herself. So I only know of these three. So go ahead.
No, I'm just saying, do these personalities talk to each other within the person? That's what I mean.
Communicate
Or
to
do
each
they
other.
come out as just personalities?
No,
But
lah. You
can
didn't
they-
watch the movie Split.
Can they
All
communicate?
27 of them.
No, I'm being very serious here. Can they talk to like say the actual person? Can
they
the
converse,
aggressive
connect to
person
each other?
Do they have
converse?
an internal conference call?
Yeah, an internal conference call.
A Zoom
essentially.
meeting, right?
There have been various ways that the clients or the patients have told us. So sometimes one is more comfortable with another, and that personality can communicate with each other. Yeah, but how they communicate, I really don't know. But it's different from a hallucination because they actually know all the different personalities, or they completely don't know any personality, and when they switch, they just switch. Yeah.
Okay.
Okay,
You
so...
can ask the question when we come back.
Okay, all right.
Geraldine Tan from the therapy room.
Australian chili buddy. Good morning, Dr. Jerry.
Morning.
So you're talking today about delusions, illusions, and hallucinations, and you just finished describing what hallucinations are, which can be audio. It can be a sensation. You were saying the five senses.
Tactile, yes. Visual. It can be olfactory, smell. You can actually smell things. Yeah, or you can actually have taste.
Okay, so from the three different ones that you've described, it seems like delusions is almost easily fixable. I mean, more fixable than illusions and hallucinations.
You can be deluded. So, like some of the schizophrenics, they have delusions of grandeur. I am king, or I am God.
Right. Okay.
Yeah. So they can be so deluded into believing that their thoughts are real.
So there can be a combination of the three as well.
Yes.
Wow.
Yes.
And why
So-
do people suffer from delusions, illusions, and hallucinations?
So the different disorders, okay, so you have your depression. So the most common one that we were talking about just now are the schizophrenias. So the schizophrenias, you have all that group of symptoms of delusions and hallucinations. But depression can come with delusions also. So that's why I thought I wanted to talk about it. Because parents sometimes get very scared when their children start saying that they see things. And, they ask me if their child is going crazy. And I go, no. It's part of the depressive symptoms. So one of the girls, and now she's, doing really well. But while she was doing her secondary 4, she was struggling a lot with depression, and from a branded school. Okay, scoring all her A's, hit prefect, but she was very depressed. When she came, she said, Auntie Jerry, I see potatoes jumping in your room.
Oh dear.
Wow.
Yeah, it was quite interesting because, bless you, Angel.
Almost sneezed there.
No worries. Yeah, it was quite interesting because she was staring at me. She was very down. Her movement really slow. And she tells me that she sees things. And she simply just, looks really like, I'm so tired. I just see all these things.
Jerry, for parents who are tuned in right now and who suspect their kids are depressed, right? What do they do?
So they go to a GP if they are really worried to come to us. Okay, go to a GP. Get a referral to a psychiatrist or a psychologist. Definitely, you can go directly to a psychiatrist and a psychologist also.
Right. Shouldn't they talk to their kids first? How do they approach, how do they start a conversation about it? Let's say they suspect their kids are depressed. How should they approach it?
So you would have all the signs and symptoms. And if those that do not know the signs and symptoms, go to my YouTube channel and catch up on all our Therapy Tuesdays, because we did talk about depression before, right?
Okay.
And all the signs and symptoms are there. So if they tick off a number of signs and symptoms, sit with the child, by that time they would be really exhausted. They would be really tired about facing this disorder or facing their moods, very frustrated, and they want to do something about it. Yeah, so then the parents sometimes would need to do the needful to help them, to connect them with the professional. Because when you are in that state, sometimes you don't want to do anything at all. You just want to lie down.
Right.
So they literally have to be dragged to my center, not dragged, but brought to the center to then sit there and say, I don't know why I'm here. And then we start the process of the therapy.
Right.
Yes.
We are speaking to Dr. Geraldine Tan from the Therapy Room. We'll continue this conversation off air, live on The Big Show TV. Meantime,
I think, Jerry, when it comes to this, especially with young kids also, parents have got to be very weary. I mean, I remember my kids when they were growing up. They all had these little friends they spoke to.
imaginary friends.
Imaginary friends. Yeah, I had imaginary friends.
You've got to be able to tell the difference between these imaginary friends and these imaginary situations.
Yeah.
Well, I've never understood this imaginary friend thing because I've never had imaginary friends.
That's
right?
what
I
you
had
think.
imaginary friends.
No, I've never had imaginary friends. Never.
Yeah, I
so
did.
so
I did
I'm
them a
just so interested to find out from Angel and from FD who have had imaginary friends.
Okay, no. I don't think I had imaginary friends. I had dolls that I, pretended had a character, and they would talk to each other and things like that. So
I think that's okay.
yeah,
That's okay.
I wasn't like talking to someone else.
Right. Okay.
You know what I mean?
But I found as a middle child, having an imaginary friend was really comforting to me.
So tell us about your imaginary friend.
What was your imaginary friend's name?
Yeah.
His name was Charles.
Oh, there you go, Charles.
And you know what he looks like and all.
He looked a lot like someone who would be my brother. And we would just carry on conversations.
And you don't have brothers.
I do have a brother.
You do have a brother.
Jerry, is this normal?
And I would just carry on conversations.
It's part of growing up. I think that's where you floated into the next fantasy versus fantasy. PH fantasy versus F fantasy.
Right.
Oh,
Yeah.
Also known as middle child syndrome.
Well, I don't think it's middle child syndrome. It's just that I found it very, very, very
Right.
comforting to have someone, because you can't. and I was very young, and you have problems in school with bullying and all this, and you don't want to bring it up to your parents, so you just nag to this guy, like.
Did you speak to Charles when you were upset more than anything else?
Usually when I was upset.
Right?
Usually when I was upset, and he was a very calming factor for me, and
Charles.
No, I can see where he's coming
and seriously,
from.
after a while, I just grew out of Charles. He just disappeared.
Because Charles would be the kind of person that didn't speak back, would agree with everything you say, and would just be that listening ear.
Really?
Yeah, just a listening ear.
And
How
would not
old were
talk
you?
back.
I must have been 8, 9, maybe.
Okay.
Glenn looks disturbed.
Back to Jerry. Yeah, exactly.
Jerry's looking at me like, yeah, Jerry, okay.
You need
was
to
it
come to the
okay,
couch.
Jerry?
Why do you need approval from me? You grew up just
there you go.
fine.
Yeah, that's what I thought.
It's like a mad kid.
No, so this is why I'm saying,
Man-child.
I'm saying parents need to know the difference between this, right?
Yes, yes. So children have fantasies. Phantasy.
Oh.
And that is perfectly fine. It is our subconscious, and we project that out. And the key thing here is that you are satisfied. You have something that helps you, and it satisfies your needs.
Yeah.
So it is unconscious fantasies, of a child, and that's perfectly fine. Children go through that phase, and we want them to go through that phase. So now I'm a little bit worried about Glenn. I'm not sure if you've gone through that phase.
No, I've not.
He's very unusual.
Glenn's Phantasy is the supreme leader.
I'm sitting here and I'm wondering why you spell fantasy with PH. At the start.
But Jerry, I just wanted to ask, what if Mark had not outgrown Charles? What if Charles was still somebody that he turned to for a listening ear at this age?
I think that would be a problem, right?
That would be a problem.
So when is the line drawn? You know what I mean? For children, it's okay. Why is it not okay for adults to have imaginary friends that they turn to when they're sad?
I bet you Charles is still there.
I'm sure he
No,
is.
he's not,
It's just
actually.
like not Charles anymore. It's just you. You're
it's
conscious.
just
You're
you.
subconscious when you talk to yourself.
And you ask yourself questions.
Interesting
Yeah, that
point.
is interesting.
Yeah.
So
So-
deep, Sean.
I am lah. Stand up and coffee a bit. Oh, Dr. Jerry, can you explain to Glenn again the difference between fantasy and
Yeah, PH and F.
fantasy? Yeah.
Yeah.
I think that some of
So-
our listeners as well.
Yeah, so fantasy with a Fantasy is, that whole conscious dreams, like daydreaming.
Okay.
Okay.
Yeah.
Okay.
Yeah. And it's that whole dreaming that may or may not come true.
Okay.
Okay. So fantasy, if you have fantasy as an adult, PH fantasy, yeah, it could be detrimental, because usually when we deal with them in the room, in the therapy room, it's things like, I know I'm not good, and nothing can help me. And, so what helped FD was Charles, right?
Yeah.
But the adults, sometimes, or the teens come in and they have beliefs that they cannot satisfy. That means they have underlying subconscious beliefs that they don't know what to deal with. And what happens, it can cause very dangerous behaviors. So if subconsciously I believe that I'm not good enough, and nothing can make me good enough, I start to feel angry, frustrated, and I start to self-mutilate. I start to
So is that a kind of a delusion as well?
So yes, so the beliefs, yes. So delusions and fantasies, yeah, they are closely tied together. So it's your subconscious, yeah. So the fantasy is something interesting that I thought I wanted to mention, and it's good for just discussing at the table and things like that, right? Yeah, but it is very difficult. That's why I say today's topic, I give myself a crazy night last night trying to draw this distinction between each one of them. But yes, yeah. So there is that subconscious delusion there.
And I suppose one of the most dangerous things you can say to a person who does have delusions, and I've heard this said to people, you're just delusional. That's probably the most dangerous thing you could say to them, right?
It is.
Depending on the situation.
I don't know if they have insight.
Yeah.
Then they would go, oh, it's a delusion, I can snap out of it. But if they have no insight, they will continue to believe whatever that they want to believe.
But Glenn is delusional every day. So what do we do about him? It's quite a difficult. We have a bench if we need to use it.
Okay. And what are we going to do with
her head.
it?
I don't know. Tie him to it. I don't know.
Only Angel knows how she wants to place me on the bench.
I thought you wanted him to do sit-ups or something.
Yeah, he can do that while he sorts his delusions out.
No, I think she just wants me to lie on my tummy and get everybody to spank me. That's
dear, hello.
Because I can't think of any
your
other
delusion.
I can't think of any other way.
That's your
That's
delusion.
not delusion. That's his fantasy.
With an F. You got the
I do fantasize a lot, actually. Yeah. Fantasise.
I was thinking of you when I did that fantasy thing. I was like, oh my gosh.
This is Glenn.
Yeah.
Okay, so what are the therapies that are conducted for people that have any one of these
So it
disorders?
depends on what disorder that they have, right? So there was a lady with postpartum depression. Yeah, so this one was a very painful one. So I needed to do grief work for her because she delivered a stillborn baby.
Oh no. Okay, I think
Yeah.
we talk about this on air. This is
Okay,
a good
hold
one.
on, Jerry. We're going for a traffic break. Good morning, Singapore. It's Glenn, Angel, FD, and Shaun. And today being a Tuesday, it's Therapy Tuesday as well. And we have our special guest, Dr. Geraldine Tan from the therapy room once again. Good morning, Jerry.
Good morning, Glenn.
Good morning, Jerry. You're talking about delusions, illusions, and hallucinations. And I asked you earlier, before we came back on air, what are the therapies available for any one of these? I know there's no cookie cutter solution, but what are the therapies that are available?
No one therapy, but it really depends on the different disorders that they present with. So one of the very exciting, not exciting, I treat everything as exciting, but one of the cases that I have was someone with postpartum depression.
Okay.
And I had to do grief work for her. So, we think depression is that CBT, but I had to do grief work for her because she had delivered a stillborn baby.
Oh, dear.
Oh, okay.
Yes. So that was very heartbreaking. And one of the depressive symptoms, so she had depression and it came with auditory hallucination. She could hear baby crying.
Oh, no.
Yeah, she could hear a baby crying.
Was this her first, did she have any other children?
No.
No. Okay.
And
wow.
she had to deliver it vaginally.
Oh.
Yeah.
Oh, wow.
So it was very difficult. So for that one, I had to do grief work. I was very privileged to see photos of the baby also. Yeah.
That must have been hard.
It's difficult. I'm getting a little bit choked up here, but to walk with her was quite an honor. So yeah, a lot of grief work for this young mother.
She doing all right now?
That was
Better?
many years ago. Yes,
Okay.
yes.
Okay.
So we had a team of doctors also looking after her.
Jerry, we're getting questions on our Facebook page. We talk about depression and that leading to delusion and illusion and hallucination.
Yes.
Is that the only way it starts? Does it have to start with depression? Are there other triggers?
So chemical imbalance. So you talk about like the schizophrenia. Like schizophrenia has a chemical imbalance. So you would need medication. So that one we don't do without medication. So the doctors or the psychiatrists will come in first and give them medication. And once they're a little bit more stable, we can work with their thought processes. Because if we simply jump in and try and work with their thought processes, they can't even distinguish whether what is real and what is not real. So there's no way I could talk to anyone. So the one that was catatonic, I had to send him off in an ambulance, have him warded, medicated before he came back. And it took quite a while before the medication worked. And only now, so it was a month plus ago, only now that he's able to start to articulate what he remembered on that day. And he was so deluded on that day because his eyes were closed. He thought he was being imprisoned and caught, and he was going to be an experimental object or something like that, because they had to posy belt him because he tried to dash out of the door.
Wow.
So you said it was on that day. So he only suffered that catatonic state on that one day. But what triggered him to go into that state?
So speculation would be high stress. So it could be biological, it could be stress related, it could be trauma related also.
Okay. All right.
Yeah, so for this boy, it was, I think he was very stressed with his work. Yeah.
Okay. I have one more question, but we can also ask it on Facebook. And I'll ask you about hypnotherapy versus medication.
Right.
So, Dr. Jerry, you were talking about chemical imbalances being treated by medication. Can
Yes.
hypnotherapy or any sort of non-medicinal therapy also do the same thing as medicine?
This is a really tricky one. I'm thinking how to answer it politically correct. Okay, because I do hypnotherapy, but I do it for therapy. But we do know that we can hypnotize a person to not feel pain. But
Did you hear that? Did you hear that, Julian?
Wow.
She does
Yes,
hypnotherapy.
something about not feel pain.
Hypnotherapy. She does hypnotherapy. I want you to hypnotize me.
To do
Jerry.
what?
Huh?
To
Have
do
you-
what?
Whatever. lah.
Whatever.
Have you ever been hypnotized?
No.
I've never. Have
I
you?
have.
And
I
what
have.
did they make you do?
Well, from what I remember of
Yeah.
it, I walked down steps, and how do I put this? I met my demons.
Huh? Hey,
So what
is it
was
that
the
serious or
purpose
not?
of it? Well, the purpose
Jerry.
was for you to face
For
something.
me to actually be able to relax more.
Wow.
How come he met his demons?
So I don't know. I don't know whether this is all in my mind or whether it actually happened.
So what they do is they tap into your subconscious. Yeah. So for parents out there, who want to hypnotize your children to study harder, to be a better athlete,
No.
I really do
What?
not
Wow.
recommend
Oh, she
that.
does not
because-
recommend that.
No,
Yeah.
no,
Yeah.
absolutely
Yeah, of course.
not.
because what you're doing is to permit your child to be more susceptible.
Yeah.
Because we have to access the subconscious. So I do that for patients or clients that are in danger. So for the schiz patient who has already been medicated, stable, but still very anxious, I did it for her. There was another mother a pregnant mother who was vomiting all the time, and she was putting her life in danger and her child's life in danger. That one, I did it for her. That was really interesting because once I did the groundwork in the session itself for a few sessions, I could just call her and do the
And
process
trigger it.
over
Wow.
What? Wait.
So you stopped her from throwing up? as
Yes.
much. Oh my
Yes.
gosh.
Wow.
Yes.
Seriously?
Yeah.
Wow. So wait.
So even puking and all that is a psychological thing.
No, it's not. But I can access that and help her to feel more comfortable, and it can go down.
Wow. So wait,
Mind blown.
just
Mind blown.
couple of steps back that you said about getting your child to study better or harder or whatever it is. Have you had parents that have come to you and asked you?
Many,
Really?
many,
Wow.
Oh my
many,
god.
Yeah.
Parents are the worst.
many.
Parents are the worst. I know.
Julian, you okay? Yeah. I mean, this is quite interesting, right? I mean, just
Yeah,
a few minutes.
I want to hypnotize my daughter so that she can be less rebellious.
How old is she
Yeah.
though, Julian? How old
Sorry?
is she? How old is she?
She's 2.5.
Dude,
It's the naughty twos.
they have a term for that. It's called a terrible
Terrible
twos.
twos.
Yeah, she's driving me up the wall.
Yes, it happens. Yes.
And oh man, I really want to hypnotize her so that she can just be less rebellious. She can, listen to Papa more.
But you know
That'll be nice.
what you have to look forward to? Tantrum
What?
threes.
Oh man,
Still not over.
Then you guys need to hang out. Yeah, go talk to Angel and to FD.
It's only just begun.
Yeah, I know, 2.5. Oh my gosh, you're not even there yet.
Okay, back to Jerry.
oh yes.
No, but the terrible twos are not terrible twos, because they are not born to make our life difficult. That's what I always tell parents.
Yeah.
They're finding
Although
their character. Yeah.
They're
Yeah,
learning from the father, actually. They do what they see, man. Hey.
Yeah, that's true as well.
I know. You know what this is called? My second one, who is also a girl, is about 3.5 months now. When she came out, when she was first born, I told a friend of mine, I said, "Oh, my second daughter just came out," and he looked at me and he said, "Oh, lovely, that's retribution for you, man." Keep going. And I said, "Oh, well."
Yeah, and look at Mark. He has 4 girls.
I did something wrong in my life, man.
Tell me about it, man.
they're all beautiful children. They're all
Yes.
beautiful.
No, but Jerry,
Yeah.
people use hypnosis for many things. I mean, for weight loss as well, for quitting smoking.
Yes. But the thing is, it's sometimes it also depends on what is the trigger or
Yeah.
what is the source.
Yeah.
Because there have been those that attempt to quit smoking, and we can make it taste like shit.
Oh wow.
Literally.
Wow.
Yeah.
Literally taste like shit. Like you would not like the taste of it when you put it in your mouth. But if the sauce is not dealt with, after a while, it comes back again. And then you go back, to the hypnotist and they say, hey, it doesn't work. It did work for a period of time, but there's no sustaining power because we did not treat the root cause.
Right.
I see.
Yeah.
I
Okay.
see.
Yeah.
Wow, you can make
Wow.
it taste like shit. I didn't know that.
Yeah.
Wow.
Not that we know the taste of shit.
Exactly. But yeah.
You know what I mean.
But the horrible thing was I loved chocolate before, but when I was doing the training, the coach did make chocolate look like shit. And it gave me that whole idea that it's going to smell like shit. And for a few years, I did not eat chocolate.
Couldn't
See.
unsee it.
That's the power of hypnosis.
Yeah.
That is
Yeah.
the power of hypnosis. It's not something
It was-
to play with.
No, it's
Yep. And he was doing it on someone else. But because I was in there looking at it, I also gonna. So I was like, oh, my
wow.
God. Yeah, that's why you can do mass hypnosis.
I was
Yeah.
going to ask because it was being done on someone else, but you also got affected.
Can. It
Wow.
can be done. So,
Oh,
yeah.
this is interesting,
Yeah,
man.
I know,
Yeah,
right?
it's-
Very
it's-
interesting.
Right,
And,
yeah.
and how instant
It's
is it?
Julian's turn.
He's like, I'm
really
fine
keen.
for
I was
you to
like-
keep talking.
No, yeah, he still have 3 minutes. And you have 3 minutes.
You have three minminutes.
You have pictures to show, so.
Oh, yes. That's
But he
right.
wants
who-
to ask
who-
questions.
is it-
Is it
Jerry.
instant? I'll answer Glenn.
What, next
Is
week,
it
ah?
instant?
No.
Is it instant?
Yeah.
It is. It can be quite. It is instant. What am I talking about? It is instant.
Wow.
Okay.
It is quite something.
Okay, I'll visit you one of these days. Okay, Jerry. All right.
Okay.
Okay.
now-
You can
Yes,
hypnotize
I
me.
was talking about like fantasies, right?
Yeah.
Dream big. So in the therapy room, we encourage people to dream big, dream as big as you want. So all the therapists, everyone here, the team is told to dream big, including the clients. So remember the Tourette's boy that I was talking about last year?
Yeah.
And how terrible he went through, and we thought we'll never get through. So he's now started Tourette's shoots. He's going to kill me that I pronounced it wrongly.
Tourette shoots, right.
Yes, because he wants to build a community for the Tourette's, people suffering from Tourette's, and say that you can do and achieve anything if you put your mind to it. And he was the one when I suggested you should brand yourself as a photographer with Tourette's syndrome. And he was like, I don't even want Tourette's. Why do you ask me to do that? So I got a big tongue lashing in the session itself. And then weeks later, suddenly I saw his IG being put up. So
Wow.
on a whim, I said, oh, why don't you do like some photo shoots for Auntie Jerry and my team? So this is what he did.
Oh, wow.
So Sean's-
These are by Samuel. So his name is Samuel, right?
Samuel, yes, Samuel is his name, and he has done some beautiful shots for us. I'm not sure if I can see.
Yeah, we can
we'll
see
see them
them.
in
Yeah.
30 seconds.
We're putting them up.
We're going
People are
through
watching
your
them now.
whole team, yeah.
Yeah. So he make us look like we're on the magazine, and he loves just really taking that raw person and just highlighting your personality. So you can see all our personalities in there.
Wow.
Nicely
Wow,
done.
wow.
Very nicely done.
Lovely,
I have to
lovely,
say.
lovely.
Stand by, we're going back on air.
We've been speaking to Dr. Geraldine Tan from the therapy room right here on The Big Show, 1FM 91.3. Thank you so much, Jerry, for
No
joining us
worries.
today.
I just need to shout out and say
Sure.
happy birthday to Glenn's mommy and to my daddy. His
Oh.
birthday is today. So
Happy birthday.
What's your
Happy
daddy's
birthday.
name?
How King.
How
Ready?
King.
Are we ready?
Yeah, let's go.
Happy birthday to you. Happy birthday to you. Happy birthday to our King. Happy birthday to you. Yay.
And many more.
And many more. Yay! And I'll end with a quote from Walt Disney. All our dreams can come true if we have the courage to pursue them.
Ah,
Too true.
absolutely.
Too true.
Thank you, Jerry.
And I'm going to hand the time to Julian. I'm so sorry.
No, it was a very, very interesting session. Very interesting.
Lovely to meet all of you.
Thanks,
and
Jerry.
hope to see all of you in my center soon.
All right.
See
Have
you
a great
soon.
day
See you next
ahead.
week.
Take care.
Bye,
Bye.
Jerry.
Take care.